COVID vaccination in the U.S. Your most common questions answered. Part 1. The COVID-19 crisis has been hard for all of us, but there is a light at the end of the tunnel. 2 vaccines have been approved for public use, and they look like a promising way to help put an end to this pandemic. Since the vaccines haven't been out for long, you may have questions about how they work, when you can get them in the United States, and how effective they'll be at combating the virus. Watch the video to find the information you need so that you know what to expect when you go to a clinic or hospital for your vaccination shots. Question 1. When will the vaccine be available? The first round of vaccines is available now. However, every state has its own rollout plan for who will be able to get this initial batch of vaccines. Most states are following the CDC's recommendations by offering the first round to frontline workers and people aged 75 or older. As more vaccine doses are manufactured, the eligibility list will expand to include more people. Frontline workers include firefighters, police officers, corrections officers, food and agricultural workers, public transit workers, postal service employees, manufacturing employees, teachers, educational support staff, and daycare workers. After frontline workers and people 75 or older, the next groups to get the vaccine will be people 65 or older, people with underlying medical conditions that put them at greater risk, and other essential workers. Other essential workers include employees in transportation, food service, logistics, construction, finance, communications, energy, public safety, public health, law, and media. It should be more widely available in the late spring of 2021. The people working on the vaccine are doing their best, but it takes time to manufacture enough doses for everybody. While there isn't an official timeline, most estimates suggest that the vaccine will be available to the general public in the late spring or summer of 2021. It will take a little longer for a child-safe vaccine to become available. Children's immune systems are not identical to adults, and more research needs to be done to ensure that the vaccines are safe and effective for children. Question 2. Does the vaccine actually work? Yes, both of the currently approved vaccines appear to be effective. Going into 2021, the only 2 vaccines that have been approved in the United States are the Pfizer-BioNTech vaccine and the Moderna vaccine. Here's what we know about the efficacy of each vaccine. The Pfizer-BioNTech vaccine is 95% effective, meaning that 95% of people will be protected from becoming ill with the virus. It is approved for anyone 16 or older, and it requires 2 injections given within 21 days of one another. The Moderna vaccine is 94.1% effective. It is currently approved for anyone 18 or older, and it requires 2 injections with 28 days between each dose. Both vaccines rely on messenger mRNA technology. Traditionally, a vaccine contains a weak or dead version of an actual virus, which is injected into your body to teach your immune system to fight the virus in the future. The mRNA vaccines work by injecting a spike protein, not the COVID-19 virus, into your body. This protein, which resembles the COVID-19 virus, teaches your body to identify and fight the actual virus as it attaches itself to the cells in your body. Question 3. Is the COVID-19 vaccination safe? Yes, none of the clinical trials indicate there's any unique danger. The COVID-19 vaccines have undergone an intense series of trials and tests, and there isn't any evidence that the 2 approved vaccines are uniquely dangerous. There are some risks if you're allergic to any of the ingredients in the vaccines, but this is true of any vaccine or medical treatment. A viral video showed a nurse getting the COVID-19 vaccine and fainting has circulated online. The nurse in the video actually had a medical condition where they faint when they feel pain. There is no evidence that the COVID-19 vaccines will make you faint. Some news has circulated online about vaccine recipients developing Bell's palsy, a condition where your face becomes temporarily paralyzed on one side. There have been 7 recorded instances of Bell's palsy reactions to the vaccine. There are 15 to 30 cases of Bell's palsy for every 100,000 people under normal conditions, so the 7 recorded instances don't appear statistically abnormal. There is a lot of misinformation out there regarding the vaccine. The reality is that the vaccines aren't going to put the vast majority of people in harm's way. The risks of catching or spreading COVID-19 far outweigh any potential side effect you may experience. Talk to your doctor about getting vaccinated if you have a history of allergic reactions to medications. People with an allergy to any ingredients in the vaccines are the only group of people that the CDC explicitly says should not be inoculated. If you have a history of anaphylaxis or other strong reactions to injections, vaccines, or medications, but no explicit allergy to the ingredients in the vaccine, talk to your doctor before you get inoculated. Your doctor may still recommend that you get the vaccine depending on your personal history and what you're allergic to, but you should still consult a doctor first. Don't worry if you have allergies to pets, pollen, latex, food, or anything like that. You're only at risk if you've had reactions to injections or medications. There are 0 reports of anyone dying from taking the vaccine. If you do get the vaccine and you have an allergic reaction, you will be surrounded by healthcare professionals who will be able to treat you on the spot, so try not to worry. You may want to wait a bit if you're pregnant or breastfeeding. If you are pregnant or breastfeeding, talk to your doctor about getting the COVID-19 vaccine. There is limited data on how safe the vaccine is for pregnant women or women who are breastfeeding. Since it hasn't been studied thoroughly, it's up to you whether you want to get the vaccine. If you're at increased risk because you're immunocompromised, it may be worth it to get the vaccine even if you are pregnant or breastfeeding. Just talk to your doctor to weigh your options.